this great topic. I could not find a better speaker, better orator rather, than Dr. Partha Das himself, who has so much knowledge in this field where IVF is concerned. Before you go, I need to ask you these questions. What are the possible side effects of IVF?
All right. So every treatment has its own side effects, ups and downs. So IVF also does have side effects. And when we talk about IVF, it means giving hormonal injections and medications. And those are the hormonal side effects like headache, body aches and pains, mood swings, hot flushes, not feeling good, feeling bloated, heaviness because the eggs are, forming inside the ovary. So there is a little bit of bloating sensation. So again, we have to understand that these hormones are transient, and once we stop the medications, everything is washed out of your body. So it doesn't stay.
So you don't gain weight or anything with that, is it?
Yes, of course, there is a weight gain. Some people experience a weight gain, and but that's transient. We advise them to drink lots of water, go for the physical activity and exercise, take your vitamins, sleep well, and it is addressed well. Yeah.
Right. So
I haven't heard anybody who's really pushed to one corner because of these ill side effects. No, because the medications are amazing. They stay in your system for 48 hours and they are all washed up.
Okay.
So this is the things which happens in this 10 to 11 days of the medications that we do. When we do the egg harvesting procedures, it is under ultrasound guided. So there are the standard risks of bleeding and injury to the bowels and bladder in and front, which is the standard surgical risks that we usually informed consent has been taken with everybody. So yes, that's pretty much it. And if somebody has a diagnosis of what we say polycystic ovarian disease, they have a lot of follicles, so their ovaries enlarges quite 2 or 3 times the size of the normal ovary.
Correct.
And they have this syndrome called ovarian hyperstimulation syndrome, where the ovaries can get really bulky. So in today's day and age, because of the advancements, we do not talk about ovarian hyperstimulation syndrome because it's a thing of the past, because we are doing the freezing protocols.
Right.
So these are the few side effects that can happen, and of course the unseen one, which is the stress and the anxiety.
Okay, now how can one increase the chances of conception?
Well, it all starts from home. All
Okay.
right. So it all starts from home. So what we usually advise is a healthy food habit. All right.
Okay.
A healthy food habit should be something like the plate should be divided 50% of good organic veggies and fruits, and the remaining 50 with pulses, good fats, and carbohydrates and proteins. Exercise 45 to 50 minutes. Now, there is no definition of physical activity and exercise. Any form of exercise which you like should be the norm.
Correct.
If I like to do aerobics, Pilates, yoga, running, marathon, or Zumba, do it, but do it.
That's almost like busting a myth, because I remember being told initial 3 months you're not supposed to do too much of running around. You're supposed to rest your body, and here you're saying no, go do aerobics, go do your Zumba.
We have our clients who are all working ladies, and they
Right.
come, they do the treatment, they take the injections, they go back to their office. Life is on the move. I have evidence to show that one of my dear patient who has got pregnant for the second time, she has been doing yoga with all those bands and postures up until the delivery time.
Wow.
And so I think it's all good. But yes, when it needs to be taken rest, we will advise that it's time
Okay.
for you to take rest. But other than that, a normal life goes forward. Drinking lots of water helps the body for the cell renewal and all.
Right.
And of course, you need to have at least 7 to 8 hours of undisturbed sleep. Yeah.
So once I have done an IVF, for example, does it mean that my second child also will have to be conceived the same way?
Absolutely not.
Okay.
Depending upon why the IVF was done. Now, if your tubes are blocked,
Right.
and the normal physiology has been obstructed because of some tubal pathology, or the tubes have been removed, then yes, IVF is the only way that you can get pregnant. But if the tubes are open and IVF was done for other reasons, which are not so this thing, so you can have a pregnancy again the second time. And many a times, most of the ladies who has got pregnant through IUI or IVF, they call up saying that, doc, after 1 year of my child, I got pregnant. we are not surprised.
Okay.
And sometimes what happens is IVF acts as a stimulus for these
Okay.
ovaries to again reignite and release a good egg, and that's how the things are.
It has worked that way as well?
Yes, absolutely. Yes.
Oh, wow.
Yes.
So that means...
So the thing that IVF once, IVF forever, no.
No.
Okay,
so that was a myth we just busted. Now let's talk about what happens if the treatment fails.
Yes, as we again have discussed this before, IVF is not 100%.
Yeah.
Right? It is a procedure which fast tracks your chances by 35, 45, 50, 60% to achieve a pregnancy. But we have to understand that there is another 35 to 40% of the couple who are not able to, get a pregnancy home.
Correct.
So if it has not worked in the first attempt, either in the form of implantation failure or miscarriages, we have to understand why it has happened. We again have to go back to the books. We have to see all those points where things were not right. We need to readdress this, the approaches, change our techniques a little bit here and there, and again reassure our couple that we can do it again. But today, in today's day and age, where we have amazing freezing protocols, if somebody has done an IVF and they have harvested a good number of eggs and have resulted in 3 or 4 good embryos, then she has got 3 or 4 attempts.
Correct.
So that means you do IVF, do it once, do it good.
Correct.
So you have one attempt, your first embryo did not implant, you don't have to do IVF again. You just have to come back to the clinic, do a little bit of thing, and put the second embryo back. And if somebody is lucky enough to have a pregnancy in the first attempt, and let's say she did a IVF at 33 years of age, and she got pregnant in the first attempt, and she has got 2 more embryos in the freezer, and she wants to come back after 3 years or 4 years to have a second child, then at 36 or 37 she comes back, but she uses a 33-year-old.
Oh, that's amazing.
That's how
wow.
so that's how she has the good chance, because she has used a young 33-year-old egg which was in the freezer to get pregnant at 36, 37 years of age.
I wish when we were younger someone told us that. I mean, we had that kind of sciences back in the days,
Science was there, but this
I think education was not
and
there.
then this discussion on the platform was
Right.
not so common. Yeah, but
So
today I think this kind of conversation is going to spread far and wide, and people are going to start thinking about it.
But I know so many people, doctor, who are doing it, and I think it's amazing. I think the end of the day, when you have that gift of life in your arms,
Yes.
there is no feeling that can come closer to that.
Yes.
It's just unparalleled to all you mommies out there, to all you women, and to all you parents who are going to be new parents, new mamas, new daddies. It's an unparalleled feeling that nobody on this planet can ever give you. It's only your kid. When you hold that little life in your hands, it's only then when you'll realize what you've achieved and how far and how beautiful life could be. Before I let you go, let's bust a few myths. We've crossed our time, but let's bust those few myths.
All right. So I'm not able to get pregnant, and the doctors have told it's unexplained. It is not at all unexplained. Everything can be explained in today's day and age. We have amazing technologies and science, behind us to, for us to do the test.
I mean, with IVF, can I ensure that I have twins?
Yes, depending upon if we have replaced 2 embryos. If you have implanted 2 embryos, then the outcomes could be outcome 1, that both the embryos will not implant and you will not get pregnant.
Okay.
Outcome 2 could be that 1 out of 2 could implant and you will be having a singleton baby.
I'm waiting for the third one.
Outcome 3 would be both of them will be positive, means both of them will implant and you will have twin pregnancies. And in the best scenario where God has showered all his blessings, the embryos can split up.
Wow.
And if out of 1 embryo splits and the other one implants, so it will be 1 plus 2, 3. And if both the embryo splits, it could be a quadruplets. But that's a very, very rare scenario, but it has happened in my practice. I've seen that.
Have you ever have had a woman come back and say, I have quadruplets?
Quadruplets, yes.
Yeah?
Yes.
Wow,
Yes.
that's amazing.
Yes, but this
I have
was
this
not
huge
recent.
smile on my face suddenly.
But we are scared because it's a obstetric complication, which we
Right.
do not want a crowd out there. But I would not boast that quadruplets happening in today's day and age. In today's day and age, no, 1 or max 2. Quadruplets does not happen in today's day and age.
Right.
Yes, and it is not right.
Do you have any parting advice to all our listeners?
Well, I would say that reaching out, if you're trying to achieve a pregnancy, you're trying and it is not happening to you, please reach out to your doctor, your primary care physician, get yourself tested, the basic evaluations and tests, and make sure that everything is okay. And if it is advised to you to undergo any kind of fertility treatment like artificial insemination or an IVF program, do not hesitate, because it will maximize your chances of achieving a pregnancy. Because at the end of the day, what do we all want? To have our families complete.
Correct.
So if it is not happening in the normal route, then try to adopt the assisted reproductive techniques like IVF or IUI or any other form of treatment which can maximize your chances of pregnancy.